Welcome to Dental Ergonomic Aids, part of our Ergonomic and Wellness web series. Today, we will be introducing various ergonomic aids found in the field of dental hygiene. Saddle stools. A saddle stool promotes a neutral pelvic position supporting the spine's three natural curves. The thighs slope steeply downward so the seated position is halfway between sitting and standing. Saddle stools place the clinician in a tripod position with the hips slightly flexed and abducted. This is the most stable position for the hip joint. Only when the lower body is stable can the upper body move with ease and precision. Finally, the saddle stool facilitates correct movement at the hips instead of bending at the waist. The picture on the left shows a saddle stool with the spine in a neutral position and the knees slightly bent. The picture on the right shows a traditional seat with the spine not in neutral position and the knees bent at a 90-degree angle. Next, we have pedo booster seats. Pedo booster seats raises the child closer to the operator's working area. This increases comfort and reduces strain. It allows for better, more consistent positioning for x-rays and procedures, meaning reduced time and less waste. The addition of a headrest for pediatric patients or for adult patients allows the patient's head to gently tilt backwards and for the jaw to naturally turn up in an open forward position. This creates perfect ergonomic positioning of the patient and helps to resolve strain for the operator. Loops. Using loops properly improves vision and patient care. The key is to purchase loops tailored to your needs and measurements. Eyeglass prescriptions should always be incorporated into your loops to prevent eye strain and headaches caused by frequent transition between prescription eyewear and loops. If you do not use prescription glasses, consider regular visits to an optometrist to detect any changes in eye health. The declination angle is the angle that your eyes are inclined downward towards the working area. This angle should be steep enough to help you attain a comfortable working position with minimal forward head posture. The farther the head is positioned forward to see through the loops, the greater the strain is on the neck. Your head position should never exceed 20 degrees from neutral. Many people use loops that violate this important ergonomic principle. These photos clearly demonstrate that even a slight tilt of the neck can create a very dangerous head posture. A 50-degree tilt means that muscles are supporting the weight of the head, resulting in unnecessary fatigue in the neck, shoulders, and the mid and upper back. Don't skip the all-important step of getting precise measurements. When choosing instruments, consider ergonomics. Instruments should be lightweight, well-balanced, and be textured for added grip and reduced strain. The diameter of instruments should be greater than 12 millimeters as they require less muscle load and pinch force to operate. Clinicians should select mechanical instruments that effectively accomplish the task and reduce force, time, and awkward posture. And of course, don't forget to sharpen your instruments. Adequate lighting. Proper illumination of the workspace is very important. Natural or color-corrected overhead lighting will help reduce eye strain. Operating lights should be mounted and adjusted to eliminate shadows on the working sites. Lights should never drift as the continuous correction can cause musculoskeletal disorders. Lighting from loops or from the overhead source should be as parallel to the operator's line of sight as possible. Gloves. Disposable gloves come in both ambidextrous and hand-specific options. Ambidextrous gloves can be worn on either hand and the thumb aligns with the other fingers. In hand-specific gloves, the thumb is placed in a natural position, reducing unneeded stress. Textured gloves add surface traction. They aid in increasing grip and lessening the risk of tiring out your hands. Additionally, some gloves are now available with aloe vera and vitamin E, both of which are thought to provide added comfort. It is important to remember that purchasing ergonomic aids will only be beneficial if you take care of your body and mind outside of the dental office. Don't forget to incorporate exercise, stress reduction, and see your medical doctor regularly. Thanks for watching. Check out our other videos on ergonomics for the dental hygienist. Don't forget to subscribe to our channel and follow us on Instagram, ergonomics.wellness. See you next time!